So many people suffer with chronic pain in the shadows. Sometimes it feels like nothing's really working. This is especially true for fibromyalgia. So, is red light therapy something that's going to help for chronic pain? There's a tremendous cost for chronic pain. It drains your energy, and many of the things that are currently offered are just band aids. Medications often have terrible side effects like drowsiness, digestive issues, and brain fog, and many don't actually get to the root causes. For example, cellular inflammation, chronic inflammation. So can red light therapy solve this problem? There's some promising signs that the answer is yes. So in this video, we're going to understand the mitochondrial response, what kind of evidence is there for red light therapy for fibromyalgia, and the specific protocols and devices that have good evidence, including what wavelengths actually are helpful. I'm Dr. Haque. I'm a doctor devoted to providing you with evidence-based insights to help you digest complex medical information. If you'd like the full references or some of my more personal takes, check out my newsletter, medicalwisdom.org. So one of the coolest things is that near infrared light waves or red light can recharge your cells specifically in the mitochondria, which are the cellular engines of energy that produce ATP. And that's what our body lives on for energy. And red light therapy can increase ATP as well as reducing oxidative stress, and they produce an anti-inflammatory effect. You've probably seen a bunch of people with red light therapy over-the-counter products. I'm not going to focus on those because there's not a lot of good evidence for them. I'm going to focus on what might actually help people. So what we see with red light therapy and fibromyalgia is a massive reduction in pain. One meta-analysis of 9 randomized controlled trials found a pretty large effect size in pain severity reduction, 62%, which is definitely significant. This is the core of what people are looking for. They don't want to feel pain. So this is an initial great finding, but it's more than pain relief. Most people with fibromyalgia complain that they wake up feeling unrefreshed, like they didn't sleep at all. So for fatigue and morning fatigue and daytime fatigue, the effect size is also pretty strong, and it has moderate certainty evidence that red light therapy can help with fibromyalgia-related fatigue. Energy is so key to getting your life back when you have fibromyalgia. I've worked with a lot of patients with fibromyalgia, and I can tell you this is huge. In addition, there's an overlap in depression and anxiety with fibromyalgia. So what we see with red light therapy is also benefits for depression and anxiety. And these are not small effect sizes. Because why? When you're in chronic pain, you're more likely to be depressed. And when you're depressed, you're more likely to feel chronic pain. Same thing for anxiety. And we also see improved sleep quality. So overall, amazing stuff, right? The other good thing is that the red light therapy benefits don't just last a couple hours or a couple days. It seems to last for a couple months. So this is different than these heat packs somebody might take. These cellular changes show some persistence beyond a couple of days or weeks even. And that's what really matters because people want to get back to their lives. One thing you might be wondering is what kind of treatment should I have? Should I have the whole body PBM? By the way, PBM just means photobiomodulation. It's a fancy term for red light therapy. So for fibromyalgia, there's some evidence showing the whole body PBM with a giant bed that you lie on or panels may be superior to localized treatment where the doctor is putting the red light specifically in 1 or 2 spots. So there's evidence for both. But when you have the whole body red light therapy, it's targeting all the tender points at the same time, and you're getting a modulation of your entire system. And a big piece of fibromyalgia is what's called central sensitization. That's just a fancy term that means the pain centers in your brain are just more sensitive. They're going to respond with a pain signal with lower intensities and types of stimulation. So the whole body red light therapy may be able to target that better. So keep that in mind. The other key thing is that with red light therapy, it certainly has benefits on its own, but the way it probably works is it improves the ability of the person with fibromyalgia to exercise again. Because why? When people with fibromyalgia exercise, they feel intense pain, they get really tired, and they can't really do it. Many doctors will accuse them of faking it, not trying, which is really terrible because anyone who's worked with fibromyalgia patients knows they are trying very hard and they really are suffering. So if you can make exercise possible again, that pain barrier is overcome. And red light therapy is reducing that pain barrier that prevents people from starting things up. Because once somebody can start up and start moving and start stretching, it's like a positive upward. The other thing is if you apply red light therapy after movement, because often after people with fibromyalgia move, they feel exhausted and they're in a lot of pain. But if you give red light therapy afterwards, you can reduce muscle soreness and what's called post-exertional malaise or extreme tiredness after movement. So just remember, red light therapy is not a replacement for movement, but it can be used synergistically with movement. So looking at a bunch of these clinical studies, we see a reduction in pain intensity, reduction in fatigue, a persistence of benefits, beyond a couple weeks to months. And overall, people are fairly satisfied and they're experiencing this in a pretty safe way. There's not a lot of adverse events across the literature. It's a very safe intervention. However, one thing to remember is there's a lot of placebo going on here because you're doing an intervention with somebody, you're showing care, you're using a high-tech thing. So people are going to have benefit from a placebo group. So how much of this is actually placebo versus benefit above placebo? I wouldn't say real benefit because placebo benefit is still a benefit. If you look at what's happening in the brain when somebody has a placebo response, their brain is changing. They're having neurotransmitters move around. They're having actual endorphins released in their bloodstream. So the placebo effect is a real benefit, but above placebo, red light therapy also shows additional benefit. So the placebo response drops the pain signal by about 18 points here from 74 to 56. Sorry, by about 22 points here from 74 to 56. But in the active intervention group, we see a drop by 43 points. So the biological light is actually driving the main effect, although there is a placebo effect. Most of the time, the biggest complaint in fibromyalgia is these tender points. So before the red light therapy, people were saying there's about 15 on average, and after 3 weeks, on average, people reported about 7 tender points. So the red light therapy is not just changing people's overall sensations, it's changing where they feel it and how much they feel it and physical sensitivity. So cutting down those tender points by more than half in 3 weeks is pretty amazing. However, if somebody has fibromyalgia and they're already exercising every day, the benefit is going to be limited. The red light therapy is hitting a ceiling where it's not adding as much benefit. That's a surprising finding. So the red light therapy is most valuable as a bridge for people whose pain is too high that they can't really move much. So consider where you are on the spectrum of being bedbound, totally in pain, to functioning, going to physical therapy 5 days a week. A common question is this red light therapy going to do harm to me? And across these studies, we see a fairly strong safety record. About 8% of people are going to report some mild transient skin changes, some redness, some sensation in the skin, which was comparable to placebo. So it wasn't really above placebo. But here, remember, there's no needles, there's no incisions, it's non-invasive, there's no recovery time, there's no tissue damage, it's not producing intense cold or intense heat, and there's no systemic toxicity because you're not taking a medication. It's a local effect that's fairly benign, which is great. One of the most common worries was whether this red light therapy is going to induce skin cancer, and that has not been something that's been shown in the research to happen. So dermatological studies have not shown increased skin cancer. So there's a number of trials that have studied this question, but in general, some of them are 1 or 2 sessions a week. A number of them are 3 sessions a week. The wavelengths are 660 nanometers and 850 nanometers, and a mixture of that, but about 20 minutes for 1 session and going for 3 to 4 weeks. So you want to talk with your doctor about which protocol is best for you, but generally that's what you could expect. Now remember, if you have chronic fatigue syndrome, many times a doctor will tell you to do light therapy with 10,000 lux, L-U-X, of white light, like bright light therapy. Well, first of all, this is different than red light therapy, but even that has not been shown to improve fatigue very much. It's stimulating the eyes, but it's not getting into the mitochondria. What really matters for energy production is mitochondria. So don't confuse bright light therapy, for example, for seasonal affective disorder, with red light therapy for pain and repair and fatigue. The wavelength really matters, and where you put it in the eyes or in the body really matters. So unfortunately, these are not devices you can buy for home. You have to get a prescription, but you want to verify with your doctor that the device they're using has the right specifications, the right power density, and it's FDA cleared ideally. But a lot of off-label use happens because a lot of devices that have been shown benefit don't necessarily have FDA approval. This is a device that has FDA clearance. It's called the FibroLux. It's a handheld device that the doctor uses on the patient. It's about 120 seconds per painful region in the body. So you remember all those trigger points. So there can be up to 15 or more trigger points. So you can imagine it's going to take about 20, 25 minutes. And it's about 3 sessions per week for 3 weeks. It has been shown to be beneficial in randomized clinical trials without any adverse effects. And it's not available over the counter. It's prescription only. So you might see this type of thing if you go in for a treatment. Other devices, as I mentioned, on the left is the one I mentioned. It's a multi-wavelength FDA cleared device. The second option is the bed, where you basically lie in a giant bed and it gives you the full body red light therapy. This probably works by optimizing central sensitization circuits by making the threshold by which people feel pain go up a little bit. And then the third type is there's some studies on focused cold lasers I would probably avoid. I think they're a little more speculative. and they focus more on stimulating deep nerve. But if you meet a dermatologist, they might talk about this. One thing to keep in mind, and this is what people often ask me, can I get one of these beds or mats myself and just lie on there? I mean, you could do anything you want, but these are more consumer product. They're going very superficial. They're only really affecting the skin surface, the dermis. They're not getting into the deep mitochondrial tissue, which is a couple inches deep in your body below the skin. And they're not irradiating things in a deep way. So they're not going to affect things as much. But the clinical grade products that have been studied in clinical trials are the ones, if I had fibromyalgia, that's what I would be looking for. However, that being said, a lot of people swear by some of these consumer products. So, talk about it with your doctor. You also want to have honest expectations. So red light therapy is an adjunct. It's not the standalone main treatment for fibromyalgia. It's got to be part of a multimodal plan of other options as well, including medications, education, exercise, mind-body interventions, and things like that. So keep that in mind. It's not the silver bullet that's going to solve everything right away. It can be helpful. So overall, this is important. It's overlooked. Most people don't use it, don't try it. It is supported by pretty good evidence, specifically for fibromyalgia. And a 4-week trial going above care with this type of evidence is a reasonable option to consider with your clinician. So consider wavelength, frequency, and think of it as fuel to get you to moving more in a way that's healthy for you. Share this with someone who you know may be struggling with chronic pain. Feel free to join my free newsletter for deep dives and more personal takes and full scholarly resources. Check out this other video. Take care.